Have you ever imagined what walking every day can do for your body? Get ready to discover the incredible effects this simple practice can have on you. In today's video, we'll explore the 10 transformative impacts that daily walking can bring to your health and well-being. From boosting brain function to preventing heart diseases, walking might just be the key to a long and healthy life. If you're seeking a positive change for your body and mind, then this video is for you. Stick around until the end for a super important bonus tip that will make a difference in your daily routine. Number 1. Digestion Improvement. Just half an hour of walking daily not only reduces the risk of developing colon cancer but also improves digestion and regulates bowel movements, a relief for those suffering from chronic constipation. Moreover, walking improves the chances of surviving colon cancer even after diagnosis, as discovered in a study involving over 150,000 men and women. Number 2. Heart disease prevention. You're probably aware that running strengthens the heart. However, walking is just as effective in preventing heart diseases and strokes. A daily half-hour walk helps prevent serious issues like coronary heart disease by reducing high blood pressure and cholesterol levels while improving blood circulation. Number 3. Pancreatic Benefits. Believe it or not, walking for exercise is a surprisingly more effective way to prevent diabetes than running. When you walk daily, there's a 6 times greater improvement in glucose tolerance or blood sugar absorption than a group of runners. More efficient use of blood sugar allows your pancreas to produce less insulin, giving it a much-needed rest to regain strength. Number 4. Increased lung capacity. Walking is an aerobic exercise that increases oxygen flow in the bloodstream, aiding in eliminating toxins and waste. In short, it's great for your lungs. Due to improved and deeper breathing, some symptoms associated with lung diseases can significantly improve. Stress and medications accompanying lung diseases weaken the immune system of those affected. Number 5. Back pain relief. Another ailment walking can cure is back pain. This is a lifesaver for those experiencing back pain during challenging high-impact exercises. As a low-impact activity, walking doesn't cause more pain or discomfort like running or weightlifting. Walking contributes to better blood circulation within spinal structures, delivering important nutrients to soft tissues, improving posture and flexibility, both vital for a healthy spine. As you walk, you stabilize your spine and strengthen muscles that keep your body upright. Number 6. Toned muscles. Muscle tone and weight loss are achievable through simple walking. In fact, just 10,000 steps a day can be as effective as a full-blown gym workout, especially with added intervals or uphill walking. Remember to maintain proper form, keep your spine straight, bend your elbows at a 90-degree angle, swing your arms, and stabilize your pelvis. Find your optimal pace, but avoid breaking into a jog. This kind of speed walking is low impact and doesn't require recovery time, meaning no sore muscles to stop you from walking the next day. Number 7. Brain stimulating effect. Low-impact aerobic exercises like walking prevent early-onset dementia and reduce the risk of developing Alzheimer's disease. Over 35 million people worldwide suffer from Alzheimer's, and sadly, the situation is worsening. The good news is that those who are physically active throughout their lives are much less likely to develop this disease than those leading a more sedentary lifestyle. That's because they have a larger volume in the hippocampus, the brain region responsible for verbal memory and learning. Additionally, walking enhances overall mental health by reducing stress and releasing endorphins, stimulating the growth and survival of blood vessels and neural cells. Number 8. A calmer mind. If body and mind are connected as they say, then this point fits perfectly on our list. Walking for 30 to 45 minutes a day, 5 days a week, significantly improve conditions. If walking improves depression symptoms in patients with major depressive disorder, imagine how it could help deal with feelings of sadness or exhaustion. Walking changes your mood for the better, even if no one warned it could. Give a like if this sounds like something you're up for. Number 9. Vision improvement. Moving your legs can aid your eyes. Firstly, walking can combat glaucoma by relieving eye pressure. Glaucoma develops when excessive fluid builds up in the eye, increasing internal pressure, affecting the optic nerve, and leading to visual impairment. Walking is recommended as one of the best methods to reduce the risk of developing glaucoma and alleviate its symptoms. Even if you think you're too young to worry about glaucoma, walking is beneficial for general eyesight. Both low and high-intensity exercises strengthen and stimulate the visual cortex, the brain part processing images sent by the eyes. Number 10. Stronger bones and joints. Walking can provide increased joint mobility, prevent bone density loss, and even reduce fracture risks. The Arthritis Foundation recommends at least 30 minutes of moderate walking a day to reduce pain, stiffness, and joint inflammation. Strengthening bones will help prevent osteoporosis and decrease bone loss. Hold on, don't leave this video, because now we have our bonus tip. Do you know the FIT formula? But what would that be? If you're now eager to go out and walk a lot, wait a moment, because you shouldn't try to do too much at once. The fitness formula considers frequency, intensity, time, and type. This approach guides the development of an exercise program. When aiming to improve your fitness, change one of these components at a time. Here's what each letter represents. Firstly, frequency. It refers to how often you exercise. This can be quantified in days per week or the number of exercise sessions per unit of time. If, for any reason, you can't walk every day, do it 3 to 5 times a week. If you can only manage a 5-minute walk, start with that, but do it regularly and gradually add extra minutes. What really matters is making it your routine. Secondly, intensity. It measures how hard the exercise is for you. It can be determined by heart rate, the weight load used, perceived effort, or other indicators. 2 to 3 kilometers per hour is a good average intensity. If that's too much for you, set your ideal pace. A good rule to remember is that you should be able to talk while walking. If you start getting out of breath and your heart beats too fast, you're going too fast. Next is time. It measures how long you exercise. This can be a specific duration or the total distance covered. 30 minutes a day should be your goal. You can also count steps to motivate yourself. A good amount to aim for is 6,000 steps a day. Again, if that's too much, you can gradually get there and start with what you can manage now. Lastly, we have the type. It refers to the specific type of exercise performed. This can include aerobic exercises, strength training, flexibility exercises, among others. In our case here, it's walking. Remember, small steps lead to big changes. If you like the content, give it a thumbs up, subscribe to the channel for more videos like this, and share your stories in the comments below, along with sharing this video with other friends and family seeking a better quality of life. Grab your sneakers now, go out, and start walking. If after your walk, you want to introduce other exercises to further tone some part of your body, here are 2 suggestions for exercises you can do comfortably at home. Thank you for sticking with us till the end. Take care, and until the next video.